Hi, Medical Wildcats. I'm Joseph Guggenheim. I'm a 1972 alum of the medical school. And in commemoration of D-Day, my topic this month is Northwestern's participation in the World Wars, World War I and II. Northwestern had a hospital in both World Wars, and they were called the 12th General Hospital, or even just the 12th, or a number 12. But they were staffed by Northwestern doctors. And this is a picture of the World War II hospital. Let's look at Northwestern's participation in World War I first. In July 1916, Dr. Frederick Besley, a Northwestern surgeon, began to organize a general hospital unit to assist the Allies in Europe. Medical officers came primarily from Northwestern, but also from Rush and University of Illinois. Nurses came from nearby hospitals, including Cook County, Mercy, Augustana, and Evanston. By the way, Dr. Besley was one of the founders of the American Board of Surgery and one of the originators of the journal SG&O. He became director and chief of the surgical services for the hospital. He was commissioned by the Army as a major, and his unit consisted of 23 physicians, 2 dentists, 65 nurses, and 153 enlisted men. It was officially called the U.S. Army Base Hospital Number 12 Chicago Unit, but often frequently shortened as Northwestern University Base Hospital or even just Number 12, because 75% of the enlisted men were Northwestern students. On May 19th, 1917, Besley's unit sailed so quickly and secretly that the enlisted men on board the ship did not even know where they were going. They were dressed in civilian clothes, and their uniforms were not issued to them until after they were at sea. For 22 months, the unit operated a 1,200 to 1,500 bed tent and hut hospital in France near the English Channel. And there's a picture of this on the right. Base Hospital Number 12 had 8 operating rooms. They treated more than 60,000 patients. Most of these were British. They returned to the U.S. in April 1919. But most of the enlisted men who were Northwestern students in 1917, when they departed, returned to the university to get their degrees after the war was over. Let's look at the Second World War and Northwestern's participation. Dr. Michael Mason served in France in the U.S. Base Hospital Number 12 in the First World War, and he became a prominent hand surgeon, doing much research on the healing of hand tendons when he returned to Chicago. And then he began organizing a hospital for the World War II engagement. He reactivated Base Hospital Number 12 with J. Roscoe Miller. Base Hospital Number 12 became the 12th General Hospital, or General Hospital Number 12, or even just shortened to Number 12. And Mason was the chief of surgery. He was joined by J. Rocky Miller, who was trained as a cardiologist. With Dr. Mason, they reactivated Number 12 in the Second World War. Dr. Miller became president of Northwestern, not just the medical school, but the entire university in the tumultuous years 1949 to 1970, when protests of the Vietnam War occurred and the Evanston campus was enlarged with landfill in the lake. In 1940, Number 12 was made an inactive unit of the regular Army, and the members received their training at Camp Grant in Illinois, and they met regularly at Passavant Hospital to discuss Army regulations and procedures. Dr. Mason began recruiting Northwestern physicians to join his group. The unit was activated on January 28, 1942, under Colonel John H. Sturgeon as the commanding officer. Catherine Baltz, who was a nurse, she was the chief nurse, recruited 96 of her colleagues in a three-month period. The nurses were required to be U.S. citizens, members of the American Red Cross, under age 40, graduates of an accredited nursing school, and able to comply with the Army's physical standards. The personnel received their pre-departure training at 3 sites: Fort Benjamin Harrison in Indiana, Fort Custer in Michigan, and Camp Kilmer in New Jersey. The nurses, officers, and enlisted men slowly made the transition from civilian life to military life. And then they departed for Northern Africa, followed by movement to Western Italy. Number 12 unit received nearly a year of military and medical training before they departed for Africa and Europe. The unit left the United States on December 12, 1942, and landed in Algeria 2 weeks later on December 26th. They were stationed at Ain al-Turk, which means Fountain of the Turks. U.S. troops began direct military aid to the Allies in May 1942. And from May 1942 until June 12, 1944, the hospital unit was stationed at Ain al-Turk, which was formerly a resort town for wealthy residents of northern Africa. Approximately 400,000 Allied and Axis troops died or were injured or could not be accounted for as a result of the fierce fighting in northern Africa. This shows a picture of two of the Northwestern faculty members who served in North Africa. The green arrow is Captain Newton Mead, who became chief of orthopedics at Evanston Hospital when he returned. And at the blue arrow is Dr. Michael Mason, who was the chief of surgery for the 12th General. This is a picture of the staff in Northern Africa. At the purple arrow in the center of the first row is Dr. Mason, chief of surgery. At the red arrow on the far right of the first row is Dr. Benjamin Bosches, who became chairman of neurology and psychiatry when he returned to Chicago. And Newton Mead on the back row at the green arrow, who, as I said, became chief at Evanston Hospital, chief of orthopedic surgery. Beginning in early December 1944, the personnel serving number 12 were located to Naples as the troops advanced northward, and various hospitals in the Naples area, including at Concerta and Anzio Beachhead. The facilities in the Naples area were very unsatisfactory, so the troops almost upon arrival started looking for someplace else to go. Meanwhile, Rome was liberated by the Allied troops in June 1944. And after searching for a suitable location in Naples, the Allied hospital gave up and moved to proposed hospitals that were a part of Mussolini's fairgrounds. They did not use these as hospitals much, but converted them to a storage facility. And the 12th General left Naples for Rome in June 1944, where they remained until November 1944. In the Rome area, they were stationed at Forte Pietralata on the outskirts of Rome, and this was a much better facility. They had new barracks built on top of an old fortress, complete with dungeon and a moat. And you can see at the bottom of this picture on the right, you can see the top of the moat. The 5-story hospital complex was much better than at Naples. It held 2,500 patients with room for an extra 500 or 1,000 on the parade grounds. Facilities included large wards, excellent operating rooms, and space for the various services. As the Allied troops moved north in Italy, the 12th General moved to Livorno, or also called Leghorn. They occupied a school that was designed for fascist youths in Livorno from November 1944 until September 15th, 1945, when the hospital was shut down. Their bed capacity was approximately 2,400 patients. The dining hall of the fascist youth camp became bed wards. The kitchen became the lab. Pantries were used for the morgue. Classrooms became nurses' headquarters. And field houses served as the post exchange. There were also tents on the parade ground for convalescing patients. The World War ended in September 1945. Japan signed the surrender documents on September 2nd, 1945, and the 12th General Hospital was deactivated on September 15th, 1945. During the Second World War, The 12th General Hospital treated nearly 30,000 patients at Ain al Turk, Rome, and Livorno. Just over half of these patients required surgery, and the surgery unit had only 53 intraoperative deaths. 53 unfortunate deaths, but that's an excellent number for considering how many patients were treated and in the facilities where they worked. The 12th General Hospital physicians also operated units to treat venereal disease, malaria, and typhus. These are some graphs of the statistics of the patients. As I said, there were nearly 30,000 patients treated by the 12 general faculty. That compares to approximately 60,000 in World War I, but the injuries were different. A little over half these patients in World War II were surgical. And this shows the diagnoses. There were many, but predominating above all were the fractures. At the bottom of the chart, you can see tetanus and gangrene, which even if you think of these as preventable complications, the numbers were very good. These were the statistics on the orthopedic patients on the fractures. Femurs predominated, followed by upper extremity. And you can see on the left the pictures of patients at the hospital in traction for femur fractures. Nowadays, these patients would have been treated with different methods and would be up walking the next day. Advances in surgery always occur in wartime, and it benefits the peacetime civilian practice. But the new procedures that began in World War II reduced the mortality and morbidity. These include whole blood transfusions, sulfa drugs, penicillin, early tracheostomies, large incisions for debridements, and secondary closure of open wounds. On the right, you can see the surgical causes of death. The neurosurgical diagnoses predominate, but there were only 53 deaths out of over 30,000 patients treated. I'm sorry, just under 30,000 patients treated. The Northwestern faculty participated in the health care of these military, of these soldiers. The faculty staffed military hospitals in greater number than any other medical school in the U.S. And the dental school civilian dentists provided dental care until 1943, when the Navy's own dental program took over. Abbott Hall trained more than 25,000 midshipmen between 1940 and 1945, and they graduated more midshipmen than the Naval Academy in Annapolis had done in 100 years. Unfortunately, there were 274 Northwestern alums that died in the war effort. Every member of the number 12 received a congratulatory letter from Commanding General John Sturgeon. It's hard to read this yellowed piece of paper, but he said, "The superior professional care for each patient brought about a very low loss of life and limb to battle casualties. Round-the-clock duty of officers, nurses, and enlisted men to duties at hand provided rapid convalescence, without which the mission of the 12th General Hospital would have failed. Each member of this command is to be commended for the important part each has performed during this campaign." And Chief of Surgery, Dr. Michael Mason, said, "They fought the enemy not with guns and bayonets or tanks and planes, but with men whom they repaired and sent back into combat. They fought by improving morale and giving the sick and wounded assurance of care at the earliest moment. Not hasty, nervous, makeshift care, but intelligent, thought-out, coordinated treatment." Well, let's get together again virtually next month, and I will have a seasonal topic. And I look forward to our virtual meeting in July.